Presley Red Eye, Turtle Clan, Seneca Nation. My role is fire chief. I've been the chief the last 8 years. We've seen significant growth. We've separated fire and EMS. Seneca EMS has gone on its own to be its own entity, to operate calls within the territory and outside. My role as fire chief is first response EMS, to respond with EMS to help on calls and to help assist when needed. To date, Seneca EMS has served over 5,000 patients that continues to grow daily between Cattaraugus and Allegheny territories. The future EMS on the Seneca territory is always having an ambulance available when people need it. That's the biggest issue we see now is the call volume climbs. We need to meet the demand. With the technology of the ambulances and the providers' resiliency, I think is part of that key to making it grow.
Seneca EMS was formed in September of 2019 at the Cattaraugus location and 2020 of March in the Allegheny location. It was formed to provide the highest level of care outside the pre-hospital setting. It is equipped with paramedics, which is the highest level that can go on outside of a hospital. And it provides coverage to get them to the facilities they need to get to, such as cardiac, stroke, any of those facilities they need to go to. With the closure of Lakeshore, I knew the people in Cattaraugus were in trouble. That 10-minute turnaround rate of just transporting somebody to the hospital and them stabilizing them before they got shipped to a different facility that could handle more appropriate care was gone, where we needed something that was 24/7 to make sure they could get to the facilities they needed to get to. I am proud of the team that I have. They're highly trained individuals, and they get out and take the call and do what they have to do in a timely manner and make sure they provide the highest level they possibly can to somebody of our territory.
My involvement with Seneca EMS was basically in helping to establish the department, embracing the concept brought forth by Councilor Presley Red Eye to establish a 24-hour ambulance service addressing the needs of our community. At the time, volunteers were minimal here in Allegheny territory, not so much in Cattaraugus territory, and we depended on Presley's knowledge of his training and EMT service in establishing this most needed service here in Allegheny. I get satisfaction from watching the Seneca EMS personnel in action on this territory, as well as seeing the growing dependency of our community as well as surrounding areas. And I'm glad to know that they're always here for us, and I'm proud of this department.
The mutual aid process, we have a lot of companies in the surrounding areas that are volunteers, and during the daytime, a lot of their volunteers are working regular jobs, so making it hard for their ambulance service to take calls, where with Seneca EMS, will get toned out and they can help our surrounding areas. It takes Seneca EMS 90 seconds or less to respond. Our crews are right upstairs, making it possible to get to our patients in a timely manner.
I'm Dr. Joe Bart, and I am the medical director for Seneca EMS. You know, when we first started to have a conversation about what Seneca EMS could be, it was around establishment of a program that would provide the opportunities for the nation, similar to at first, and then exceeding the scope of practice and otherwise the expectations of what the surrounding community is for. So when I describe it to colleagues, I use the word exemplary, because I think the organization is following along the standards and the expectations that other organizations would want to make an example for themselves. The greatest asset of Seneca EMS is the people. Any organization, I think the secret to longevity is to surround yourself by good people. You know, so when we have those conversations about assets and where does that start, when we start from our leadership structure and we work our way down, the example of strong leadership is going to be displayed within the membership that are there. You know, one of the strong things here is that we don't need to offer positions and opportunities to everybody. The organization that exists with the individuals that are employed are hand-selected on purpose because they meet the mission and they meet the discipline and certainly meet the organizational expectations of what we want for EMS professionals. After that, I think one of the strongest suits is clearly the support when it comes to the equipment we're able to purchase. Nothing is Nothing is not completely thought of, and it's a thoughtful process when we talk. It's not willy-nilly, just not out there spending money to get gadgets and things, but the dedication towards the equipment, the rigs, the patient care is second to none.
Okay, hi, I'm Sandy Jemison, Wolf Clan of the Seneca Nation. I've had many experiences with Seneca EMS, but one of the scariest times was when I had a heart attack in the middle of the night. It was about 2 o'clock in the morning, and I felt that crushing pain like an elephant was sitting on me. And I called for my daughter, my grandson was with me, and my granddaughters, and they helped move me to the living room. By the time they did that, from my bedroom to the living room, the ambulance was already there. I couldn't believe how quickly they responded. Once I got in the ambulance, they were very professional, yet they talked to me. They talked me down out of being scared. They gave me aspirin, which in the end they told me that really helped. Hooked me up to everything, and off I went to Buffalo General. I was really scared because I had had a stent put in many years ago, and now for this to happen, it really scared me. But they talked me through it, got me there. They stayed right with me. They got me up into the emergency room. I was fast-tracked, I think. I don't remember everything. But they got me in there, and next thing I know, I was in the Gates Vascular Institute and getting set up to have all the tests. And I did have a bypass. And I wanted to thank them, but I ended up being in the hospital for 70 days. I had an infection in my body that went to my bones. And so having the ambulance there and going when I did really did save my life.
Hi, my name is Terry Sue John, and my story begins on my way to work. I wasn't feeling well, didn't know what it was. By the time I got to work, I'm gonna get emotional. By the time I got to work, it was getting worse. I got upstairs to my desk, and I'm talking to my coworker, who is also EMS, and I said, I don't feel good. So she asked me questions, and she says, I'm gonna call an ambulance, if that's okay with you. I said, okay. She goes, and I'm gonna call your husband too. And by the time we got downstairs, the ambulance was already there. I don't know, it was just, they were all so friendly and helpful. They were letting me know that my family was outside the ambulance. They stayed with me the whole time. The guy that took care of me, he kept asking me the same question over and over again. I'm thinking it was odd. He wanted to rile me, but he probably just wanted to keep me awake. And I got there. They had everything all ready for me. And the ambulance crew stayed with me, and I remember one of them telling me, your family's outside, your husband's on his way.
My name is Tina Abrams, and I'd like to share my experience with the EMS team in regard to EMS Recognition Week. When my granddaughter Charlie Ray was involved in a serious bicycle accident, after quick response from the EMS squad, an analysis was made that she had to be transported to Buffalo Children's Oshai Hospital. The EMS team was professional and calming for our family, and she was able to heal quickly. Just like all other EMS first responders in our community, many risk their own safety. They take time away from their families and treat people like their own family. The type of calls handled 24/7 are accidents, heart attacks, COVID-19 cases, breathing difficulty, drowning, overdoses, and acute illness. I would like to express my sincere gratitude to all EMS teams For their compassion, care, and devotion, they are truly heroes. Yahweh, for comforting us in our time of need. Yahweh, for risking your own life and safety. Yahweh, for your warrior spirit and bravery. Most of all, Yahweh, for your commitment to our communities.